which is a drink made from a flower that is bright red like cranberry. That, by the way, can lower your blood pressure by 6 points. Hi friends, was your blood pressure high the last time your doctor checked it? My friend, she had a headache. Then she checked her blood pressure and it was so high it scared her and surprised her. The last time she was at the doctor's office, her blood pressure was normal. But looking back, she did have a few high readings, but her doctor said you could have white coat syndrome. Now, I learned in medical school that white coat syndrome was no big deal. But the thing is, that's not true. And if left untreated, you could be at higher risk of damaging a vital organ like your heart, your brain, or your kidneys. But the treatment of blood pressure is not necessarily popping a pill. Now, we know pills, they work very quickly, and despite the push of this multi-billion-dollar industry, we also know most patients stop taking them. And on top of that, majority of people who are popping pills for blood pressure need to pop more than one pill. My name is Dr. Liu, and I'm a double board certified physician practicing for nearly 30 years. Now, of course, I'm not your physician. This video is for informational purposes only. And it's super important that you work closely with your own personal physician whenever you're dealing with high or low blood pressure. Either end of the extremes is simply not compatible with feeling well or living. Now, the problem is most people, they don't realize what passes through your lips will change your blood pressure. Good blood pressure control on a daily basis is a balance in the right amount of water, electrolytes, solutes like sugar, and immiscible liquids like fat. So in other words, what you eat and drink makes a huge difference in your blood pressure control. So in this video, let's talk about the most important reasons for uncontrolled high blood pressure and some solutions to support you in overcoming them. Now remember, this isn't medical advice. If your doctor prescribed you medication, don't change them on your own or really anything else in your diet and lifestyle without talking to the prescriber. So the number one reason people don't have good blood pressure control is the fact that a prescription medication, they're the permanent solution or the backup for high blood pressure. So they're surprised all of a sudden that the doctor has to then add more and more. Now, I find this attitude in my own family. Hey, I'm okay because I'm on blood pressure medicine. And in my head, I'm thinking, are you really okay? Because if you were okay, why would you be on blood pressure medicines? Now, don't get me wrong. I'm a huge believer of the effectiveness of blood pressure medications when used appropriately and necessary. So when you have an acute crisis that can lead to a stroke or heart attack, blood pressure medications are not only very effective, but they're necessary in lowering your blood pressure within minutes so that they preserve an organ or your life. But they always end up failing eventually over time because they're not addressing the root cause of why you have high blood pressure in the first place. So I think I finally figured out the disconnect of why the medical system is struggling with getting people's blood pressure under control. You see, as physicians, we are taught to address the urgent and emergent blood pressure with medications. But when you live with elevated blood pressure numbers every day, there's no longer urgent or emergent, at least not by your body. It means your body has gotten used to that as your new abnormal normal. Now, that doesn't mean it's healthy or that it's a longevity plan. And that's why we're trying our darndest to improve people's blood pressure. And when you have a blood pressure crisis, we admit you to the hospital, right? Some people feel like they're held hostage because they can't go anywhere and they're stuck in an expensive hotel room. But of course, you get special room service. Someone checks on you multiple times a day. They'll literally check your blood pressure, assist you in and out of bed, potentially even take care of your wounds if you have any, and will literally give you breakfast, lunch, dinner, and snacks if you request it in bed. But when people go home, they can't take the staff with them. Nobody's going to harass you to check your blood pressure or remind you to take your medications or drink your water or eat better. So in essence, a hospital environment does not replicate well at home. And unfortunately, if you don't get your medications right, your food right, your hydration right, your exercise right, there are really bad consequences that start with elevated blood pressure. That's why older patients get discharged on more aggressive blood pressure medications, but then they end up having more complications and even get readmitted within the month of getting discharged because of blood pressure issues. And that's why the first thing anybody should be doing if they're struggling with high blood pressure is literally to check your blood pressure multiple times a day, as if you were your own personal nurse. And then you call up your healthcare provider's office to say, hey, I got these numbers. What do you think about them? You think I should do anything different? And is your blood pressure medication good enough? Or maybe you're taking too much of them. Remember, your health is a partnership between you and your doctor. And that brings us to point number 2. You got to be aware of how your blood pressure fluctuates throughout the day. If you never check your blood pressure, you're never going to know how it changes on a day-to-day, hour-to-hour basis. Too many people wait until they have symptoms before they do something about it. And by the time the ER is checking your blood pressure, you have really bad symptoms. Now, these symptoms could include fainting, falling on the floor, chest pain, severe headache. That means there's going to be some in-organ damage, maybe a fracture in some bone, joint, or organ. That doesn't seem like a good way to sustain health span or longevity. So when you're in the hospital or acute care system model, which, by the way, is the best in the world, that model doesn't work at home unless you are able to replicate it. But there's not enough money to pay for everybody to have home health to go out every day, let alone multiple times a day. High blood pressure is the number one diagnosis in primary care office visits. And as medical doctors, we all know that it's controllable because we get you really good before we let you leave the hospital. So when we see an elevated number, we are all obligated to give you a prescription before you leave the office. Yet more people have high blood pressure and they're uncontrolled. And we know that people don't like to take their prescription medications. So what's a more practical solution? Well, I think that's number 3, your lifestyle, which is actually what is recommended by the American Heart Association in reducing the risk of cardiovascular diseases. It really needs to start with addressing your lifestyle first. Now, lifestyle is not some abstract thing. It is in essence how you move your body or how you don't move your body, what you eat or what you don't eat. I don't think people realize the impact of movement and food, not necessarily the movement of food, but the movement of their body has on their blood pressure numbers. My friend was certainly surprised about that. I told her to start moving to reduce her blood pressure, but she didn't notice it until she started recording what she ate, how she moved, and her blood pressure numbers. Then she could see a trend. And whenever her blood pressure numbers went up, she just went up and down her stairs for about 30 minutes, and that was good enough to get her blood pressure normal. But then she thought, why am I abnormal that I have to move several times a day? Then one day her brain started working better when her blood pressure numbers were better. And she realized that her body was meant to move several times a day, all day long. And what was abnormal is that she stopped moving, especially as she grew older. And so when she tracked how she ate, she noticed that every time she ate out in a restaurant, the next day her blood pressure would be more difficult to control. Isn't that something to be able to track your numbers? And I think that is so important. So if you don't write in a diary or in a notebook or, on a piece of paper taped to the refrigerator, you really should start doing that. And by the way, if you find values in my videos, would you mind checking if you're subscribed? And if you are not subscribed, please hit the subscribe button, like button, and share button, because it does change how many people get to watch my videos. I appreciate your partnership in helping to change the world. So number 4 is that she finally realized that if food can elevate her blood pressure, then there must be food that can lower her blood pressure. So she asked me, what kind of foods are good to lower blood pressure? And the very first food that I think is easy addition that you can even bring to restaurants is ground flax seeds. Now, flax seeds can reduce blood pressures if you eat enough of it and if you eat it consistently. So food is not the same as medicine. It doesn't work immediately like blood pressure medications, but they can work actually within hours and days. So in fact, if you start adding blood pressure lowering foods, but you don't adjust your blood pressure medications, you may find yourself one day that your blood pressure medications are now too powerful and your blood pressure will be too low and you're not going to feel very good. That's why I always encourage people to not make any changes in your diet until you let your doctors know what you're doing so that they can help you adjust your medications. So that brings us number 5, providers who will work with their patients. Now, if your provider doesn't believe in the power of food, find yourself a provider who will. And there are plenty of doctors who now understand the power of food and nutrition. Do you really need to be serving hamburgers and hot dogs and turkey sandwiches or ham sandwiches and soda and ice cream? Blood pressure medication should be a bridge to buy time for patients to change their diet and lifestyle. But they don't know how to change their diet and lifestyle. It's not like you could just refer them to a resource. I mean, really, this education really should be referable, like taught in elementary school and junior high and high school and college. In fact, families should be passing along to their children. But we're far from that. And if you think about it, how did John Adams live till 90? He didn't have blood pressure medications. Turns out that he gave up a lot of the foods that he once enjoyed and he started eating more whole food plants because he had digestive problems. Literally, there were no blood pressure medications in the 18th century, folks, and he lived till 90, despite the fact that there was smallpox. So personally, I think the best time to reintroduce a good diet is when people are fasting from their old diet. Hence, when people go in the medical system. But being hospitalized is not a good thing. So how many of you have actually read the American Heart Association's dietary guidelines that literally states poor diet quality is strongly associated with elevated cardiovascular risk, morbidity, and mortality? But how is this being addressed by anyone in the community? I mean, they literally wrote a paper specifically highlighting this dietary problem. And yet the medical system isn't set up to take care of this problem because we have to go against a $1 trillion food industry creating the problem, incentivized by policies that encourage cheap quality foods. I won't mention all the insurance factors either. Hence, for the near future, I think we all just have to be wise and vote with our wallets.
Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
So number 6, next time you're in the grocery store, buy some flax seeds, which is what I call brown gold. Now, whenever I ask my 93-year-old mother-in-law what she wants from the supermarket, she always asks me to get ground flax seeds, which she sprinkles on her breakfast oatmeal. Now, if you don't like it with oatmeal, you can always put it in a muffin. People who ate flaxseed muffins could drop their diastolic blood pressure by 7 points, which doesn't sound like a lot, but it would actually result in 46% fewer strokes, 29% fewer heart disease over time. I mean, some of our blood pressure medications that are called calcium channel blockers, like amlodipine, reduce blood pressure by just 8 points. But unlike blood pressure medications, flax seeds have other side benefits. Those include lowering your cholesterol, lowering your triglycerides, lowering your blood sugars, lowering inflammation, fixing constipation, and it helps to lower the risk of some cancers. So that brings us to number 7, which is side effects. Now, when you eat food, you generally get side benefits if you're eating whole foods. But when you eat chemicals, concentrated chemicals, whether that's in ultra-processed food, where we've confused that with food, or you're eating drugs, you get side effects. I mean, for example, when you eat sugar, that's a chemical. You're never going to find that chemical in nature unless man has manipulated it in concentrated form. And we just think, oh, it's just going to satisfy our taste palate. So let's sprinkle some sugar in water, in soda, in fruit, in your, coffee, your cereals, your sauces, and your meats. Well, the problem is sugar just doesn't stay on your tongue, right? You swallow it, it interacts with your gut microbiome, it interacts with your liver, it interacts with your muscles, your blood vessels. And then if you have an excess, because you're eating it throughout all your meals and all your foods. It hardens up your proteins to raise your blood pressure. These are all side effects of chemicals, and these side effects develop over time. Soda isn't going to do all these things the same day, but if you drink enough soda regularly and then pile on the sugar and other stuff like desserts, pastries, sauces, and then you layer on the fat, well, more side effects will pile on. And with prescription medication, it's targeting one pathway involved in the disease mechanism of high blood pressure, which, if you think about it, goes against your normal compensatory regulations of the body. And your body is your smartest bio AI, so that when it sees obstacles, it's going to figure out how to correct it. And on top of that, some of our wiring is repeated in multiple different organs so that we may think we're dropping our blood pressure, but we're also blocking other pathways to allow normal physiology to happen. And these unwanted effects are side effects. For example, let's take that calcium channel blocker. It blocks calcium channels. Calcium is needed to contract your muscles, and that's how it lowers your blood pressure, because you have smooth muscles in your blood vessel walls. And when it blocks that, then it can't contract and shrink. Well, your heart is also a muscle, cardiac muscle. And a known side effect of calcium channel blockers is to slow down your heart rate. So if you're on a calcium channel blocker, that actually prevents you from increasing your blood pressure and also prevents you from increasing your heart rate. Well, sometimes when you stand up, it may make you pass out. It's not good for compliance, right? If you can't contract them, you start pooling fluid in the ankle and you start swelling. And then we have muscles in our GI tract, and you may get constipated because smooth muscles are needed to contract your intestines for you to squeeze the poop out. As a result, some people feel really tired, they're constipated, they have irregular heartbeats, they have headaches, lightheadedness. And all these side effects make sense because when you take a drug normally blocking a normal process like your blood pressure for very good reason, right? Because your blood pressure is too high for your body's own good, then your body will try to compensate to keep that blood flow going. And I'm not telling you these side effects to discourage you from taking medication. It's really already working for you if you're on the medication and you feel okay. But all I'm saying is medication is a bridge for you to get your lifestyle right. And ideally, if you can get off your medications, you can avoid the side effects. But sometimes the body gets so damaged that you can't stop the medications. That is why you should never stop or start your medications without speaking to your own personal doctor. But if you really think about it, your food has medicinal properties too, because it too is made out of chemicals that interact with your body. And the point of this video is to help you realize that you are in control of your own blood pressure. And every time anything passes through these lips or your lips, whether you're taking a medication or taking the wrong food, you're giving up control to that medication or food. And sometimes that may work in your favor, but sometimes the side effects outweigh the benefits against your well-being. So if you're regularly taking medication, do you know what your blood pressure value is or how often you should check it? Now, I don't think there is a clear consensus. The Europeans recommend checking 2 out of 7 days. The Japanese recommend checking maybe 3 out of 5 days. My whole thing is, what's wrong with checking every day? I mean, literally your blood pressure adjusts every day throughout the day and in response to stressors. Whether you have less water, you're dehydrated, you're sweating more, that changes your blood pressure. So wouldn't it be good to know what your blood pressure is, especially if something has changed? In the hospital, we check it at the minimum 4 times a day. Like, why wouldn't a person do that outside? It's literally, I think an important parameter to know before you take medications. And I think it's a fair enough question since we know there are lots of bad complications when you overshoot or undershoot blood pressure medications. And just because your blood pressure is normal like last time, it doesn't mean that it's not going to change, right? And it doesn't mean that you should be stopping your medication either. Literally check with your own personal physician, again, before you stop anything or change anything, because your blood pressure is that sensitive. And if you don't know that fact, it's because you're not checking your blood pressure to figure out what it's doing throughout the day based on what you're doing throughout the day. Now, number 8 is that people don't think about why they need blood pressure medication. Now, yes, I understand everyone is aiming for a lower number, but why do you have a high number? I mean, have you had this all your life since childhood? Probably not. So what are you doing to earn that high blood pressure medication? Because if your goal is to live long and to have a longer health span, then that blood pressure needs to get under control. And I think it's important that you figure out why it's even out of control. And if you fix that, then you may not have to stay on blood pressure medications for the rest of your life, because you will probably need to be on more than one and then have side effects from more than one, and the consequences of requiring all those medications too. So wouldn't it be nice to graduate from being dependent upon blood pressure medications? But that would mean that you have to live intentionally and design your lifestyle intentionally. And the reason why that I keep making blood pressure videos is because too many people, they don't realize that having abnormal blood pressure suppresses your immune system, and having a normal blood pressure optimizes your immune system. In essence, your arteries are bringing nutrients and immune cells and inflammatory signals that travel all over your body. And when you have high blood pressure, it silently damages some parts of your body. You will age faster than you need to. And the other thing is that when you have high blood pressure, the first organ that suffers is your immunity. It weakens your response to stresses because your arteries are getting choked off. And you can see this on your skin. Your skin is aging. You'll probably notice more wrinkles. You're losing more hair in the distant parts of your body. And you may start having chronic back pain or impotence. And some people, their vision starts to slowly go. They start having eye problems, or their kidneys go. Their kidney function starts creeping up, or they get cancer. Do any of these sound like good things to have? High blood pressure causes all of those things. And even if it's not the primary cause, it will make any medical condition even worse. So the next time you want to buy a drink, consider getting yourself a tea like number 9, Hibiscus tea, which is a drink made from a flower that is bright red like cranberry. That, by the way, can lower your blood pressure by 6 points. And again, they may look like tiny changes, but that's the thing when you're talking about tiny spaces such as your blood vessels. If you can reduce that pressure by even 5 points, you can reduce the risk of strokes by 14%, fatal heart attacks by 9%, and overall deaths by 7%. So believe it or not, Hibiscus teas was put on a head-to-head trial with NACPro and was found to be just as effective as a starting dose of the medication. Now, number 10 is adding fresh produce. Do you know that less than 15% of your fellow Americans actually eat the recommended intake of fruits and vegetables? No wonder we have a blood pressure crisis. We're never going to get on top of blood pressure if people are just missing the most important ingredients required to get good blood pressure. They're not getting enough potassium. They're not getting enough magnesium, nitric oxide, and vitamin C. And guess which of the food groups have all of these essential nutrients that you need? Leafy greens. You can't store nitric oxide, so that you have to eat these throughout the day. It's like as soon as you eat it, your body uses it up. Your blood, unfortunately, is not an accurate reflection of your body's stores of potassium and magnesium. And we know from dietary surveys done over the last few decades that people are severely deficient in eating enough potassium to balance your sodium and enough magnesium together lower your blood pressure. So if you're serious about lowering your blood pressure, you got to eat more leafy greens, and you got to eat it throughout the day. If you want to know which ones to start first, watch the next video.